Hi everyone, this is Neil from singlebestanswer.com. Head over to our website where you will find a resource dedicated to help you pass the UK MLA exam or the PLAB exam. We have built our question bank from the ground up based on the UK MLA curriculum. Today we are going to take a look at a neurology question which hopefully will be fairly straightforward but will need a bit of working out. Let's get to it. We've got a 67-year-old man who, over the past 24 hours, has not been able to walk. He's found it increasingly difficult to mobilise for the past 7 months and is now mostly wheelchair bound. He does report intermittent neck and lower back pain, but he denies any change in bowel habit or bladder problems. On examination, he has increased tone in the arms, reduced power in the legs and brisk reflexes. So what are we thinking? We're looking for an anatomical lesion that would explain all of his signs and the fact that he's no longer able to walk. Where would we find such a lesion? Well, that would be the cervical spine. So the most useful investigation is actually B, an MRI of the cervical spine. We're looking for something like a prolapsed cervical disc that would cause lower motor neuron and upper motor neuron signs. Let's have a look at the other options. Option A is a CT of the head. This may be useful if we're looking for a brain tumour, for example. It wouldn't anatomically fit with the presentation. If you're thinking about things like multiple sclerosis, then an MRI would be better than a CT. That would tend to cause intermittent and fluctuating symptoms separate in time and space. What about option C, an MRI of the lumbar and sacral spine? Well, that would explain weakness of the legs if there was a problem such as a prolapsed disc. It would cause problems with bowel or bladder dysfunction, which he doesn't have. But in terms of brisk reflexes, we're looking for something higher up in the cord. Remember, the spinal cord terminates about L1 or L2. Usually a prolapsed disc sits around L5 and most commonly S1. So you would get things like a foot drop, incontinence, loss of perianal sensation. We haven't got that here. What about D, nerve conduction studies? Well, if I was looking for something like a common peroneal nerve palsy, peripheral neuropathy, for example, then yes, D would be useful. But not in this case. It wouldn't explain the distribution. E is the least useful of them all. If the patient had history suggestive of metastatic cancer, for example, then certainly E could be useful to look for a bony lesion, but that's not the case here. So we're going to go for B, which is the right answer. I hope you found that useful. Check out our YouTube channel or go to singlebestanswer.com for more of these little clinical vignettes. We've got a database of thousands of questions at your disposal and every single question is mapped to the curriculum. Best of luck in your exams and we'll see you next time.